Hi everyone, welcome to researchmd.com. We are bringing research into you. Today's research question is like, does faster eating speed causes like erosive gastritis? Okay. Now remember, all our presentations are like 100% pure science. There should be a like scientific study behind it. Otherwise, we are not going to publish or we're not going to make any presentation. Okay. So the question is like again, does faster eating speed cause like erosive gastritis? I know, when we grow up, our mom or parents always say like, can you chew your food, right? So let's see what happens. Again, my name is Pramil. Cheriyath. I'm a program director, internal medicine residency, transitional residency. I teach medical students and residents, director of research, and I'm also an assistant professor of medicine. Okay. So what is erosive gastritis? That is like damage to gastric mucosa, because all this like gastric contents like acidic stuff come and like they damage the mucosa, right? There's an imbalance, you can say, like there's some defense and offensive factors, right? You need a balance in between them. What are the defensive factors? You have mucus, bicarbonate, tissue generation, and mucosal blood flow. What are the offensive factors? Mainly the gastric acid, the pH of it, pepsin, NSAID, alcohol, and Helicobacter pylori. So you want a balance between the defensive and the offensive factors to prevent erosive gastritis. When there is an imbalance, you're going to have erosive gastritis. Okay. So the next thing is like we did some literature search. We find this study in a Korean Journal of Family Medicine. So let's see what the hypothesis of the study or like objective of the study to look at, is there eating speed and is associated with increased risk of endoscopic diagnosed erosive gastritis. Okay, that's our clinical question. So method is a cross-sectional study, large number of people. I think around 10,893 adults. So they created the model and did the analysis. And so what did they find? So they find out as the eating speed increases, right, the risk of developing erosive gastritis is extremely high. You can say 71% higher. I mean, the eating speed is like, if it is less, the more likely. If it is eating speed is like less than like 5 minutes, they're finishing the meal, and then compared to the eating speed of somebody taking like 15 minutes, the risk is like 71% higher. So it's clearly shown in this model. The eating speed is like the faster you eat, the more likely you're going to have erosive gastritis. Okay. So based on this study, it can clearly say that high speed eating or like eating in a high speed is an independent risk factor erosive gastritis. Okay. Thank you. So we may want to consider slowing the way we eat or chew our food a little bit more, and it will be good for to prevent something erosive gastritis symptom. Thank you so much for watching. We'll be back with another presentation soon. Thank you.